Mycetoma, it is one of the neglected tropical diseases. It is endemic in what is known as the mycetoma belt. Sudan, Senegal, South America, India, Senegal, Somalia, Kenya, Saudi Arabia, Yemen, as well as Mexico. There are two types of mycetoma. The fungal type, it's called an eomycetoma, and the bacterial type, and it's called actinomycetoma. Mycetoma is unique because it affects the poorest of the poor population in remote areas, and it is having the most expensive treatments. Mycetoma is commonly seen in young patients, farmers, and workers dealing with the soil. It is commonly seen in young patients, in rural areas, in farmers, and those are dealing with activities in the soil. In Sudan, mycetoma is endemic in central part of the country, the Jazeera area, the White Nile state, Sinnar state, and there is some pocket in Kordofan and Darfur. There is no definite data about the incidence and the prevalence of mycetoma. But in one village in Sudan, we found about 70 cases out of 2,000 population in that area. And that make the incidence is very high in endemic areas. The report from one center in Mexico, they report about 5,000 cases, and another center report about 3,000 cases in one center. In one village in Sudan, recently visited, we found about 70 cases out of 2,000 inhabitants in that village. And that indicates that it is highly endemic in that area. They are staying in the remote areas. They have to have quite a long time to reach the center here. It is very expensive for them to buy the treatment. The fungus or the bacteria are implanted in the subcutaneous tissue, and from there it is spread to affect the skin, the deep structures, the muscles, and the bone. And eventually it will lead to massive deformities, destructions, disabilities, and it can be fatal if not treated properly. Till now, there is no clear cuts, the explanation on how the infection is taking place. But the common theory that the organisms are found in the soil, implanted in the subcutaneous tissue, and from there it is spread to involve the skin and deep structure. Mycetoma, although it is a benign inflammatory condition, it has all the malignant behavior. They recur after adequate treatment. They can spread locally, local destruction, and they can spread by the blood and by the lymphatics. Unfortunately, there is no clear-cut control programs or measurement to prevent the disease, because still we are not sure on how the infection is taking place. Because it is one of the neglected tropical diseases, there is no accurate data on the incidence and the prevalence of mycetoma around the globe. And we are hoping that there will be an international move trying to get more information about the disease around the globe. Mycetoma enjoy all the characteristic features of a neglected tropical disease, commonly affecting the poor of the poorest communities in rural areas. The people are of low socioeconomic status. They are extremely poor. They have a low voice. There is no attention to them, and meager research has been done in this area, and there is no epidemic on mycetoma, just like Ebola virus and HIV and this, and that is why it is low attention has been focused on this problem. In many countries, the problem is neglected by the community, by the patient themselves, and the health authorities. The drugs are very expensive, so many of the pharmaceutical companies would not help in providing these drugs for the patient. Very small amount of research was done on mycetoma, and again that is maybe an important cause of the low visibility of the disease at this site. Eventually, the mycetoma now, it is recognized by the WHO as one of the neglected tropical diseases. We managed to establish an international consortium of mycetoma, and the consortium is doing a great job to make mycetoma more recognized globally and trying to raise funds to help the mycetoma patients. One of the important challenges we are facing now, it is to offer the patient a safe, affordable medicine and treatment. The available treatment for mycetoma are not very effective. The cure rate is about 27%. The drugs are toxic, not available, and they have many side effects. The patient may take the treatment for more than 1 year, sometimes more than 3 years, without effect. And eventually the patient may end in an amputation. So the main challenge it is to find a new, safe, effective, cost-effective drug for the patients. Even the diagnostic tools to establish the diagnosis of mycetoma are not very efficient. They are expensive, they are having many side effects, they can be toxic, and are not available in areas where mycetoma is endemic. One of the endeavor of the center it is to establish diagnostic tool which can be used in the field in a friendly manner to have a proper diagnosis of this patient. The treatment of mycetoma depends on the underlying cause. Is it a bacterial or is it a fungal type? For the bacterial type, we always use the antibacterial drugs. The problem with these drugs, some of them are very toxic, has many side effects, and it may require treatment for more than 1 year, which is expensive for the patients, the family, and health authorities in endemic area. And some of them may not respond to this treatment. For the fungal type, this is a big problem because it's always a combination of antifungal treatment and surgical intervention. The antifungal treatment available nowadays are ketoconazole and itraconazole. The itraconazole, it may cost one patient about 5,000 American dollars per year, and that it is very expensive for the patient, the family, and even for the health authority. Bearing in mind that the income of this patient may be not more than $30 per month. So the patients have to interrupt the treatment. They have to interrupt the treatment, and interruption of treatment means that resistance of the organism to the available antifungal treatment. Both of them are not very effective. They have many side effects. They are toxic. The surgical treatment, again, has many effects and side effects. The patient will end in deformity, disability, or major amputation of the affected part. In endemic areas and in developing countries, amputation is a social stigma. And a lot of people, they don't come for treatment because of the amputation. The main challenges facing the patients are, most of them are living in remote areas. They have to come for a long distance to the center or other health facilities. During raining season, they may have a cut-off roads, difficult transport, and they cannot come during that time. And that means they're going to interrupt the treatment, and that will lead to resistance of the treatment in the future. Because the drugs are very expensive, the treatment in general are expensive, many of the patients, they adopt a local native treatment. And again, that is a big problem because that will delay them. It has many side effects and many complications of applying this local native treatment for the patient. And again, that will make the disease progress badly, and that will lead to secondary bacterial infection, and again, that will lead to poor outcome of this patient. Most of the patients present late. They present late because they have a low socioeconomic status, they have a low health education, They have problem with transport coming to the center, and the problem because mycetoma, it is a painless condition. And the fear of having amputation, again, this is an important cause for the delay of the presentation to health facilities. So the combination of low socioeconomic status, low health education, the difficulty in getting to the center, as well as the painless nature of the disease and the slow progress, all this has culminated in the late presentation of this patient. There's a good amount of research has been done on mycetoma, but still there is a lot of gaps in knowledge in mycetoma. We have to bridge the gaps between the knowledge we have in mycetoma to have effective, friendly, non-invasive diagnostic tool to reach a diagnosis. We need to know exactly how the infection is taking place, what is the factors can lead to mycetoma, and what are the factors which can prevent mycetoma. We would like to have an effective control program to control mycetoma infection. With awareness globally on mycetoma, there will be bridging of the gaps in the knowledge of this problem. We hope that we're going to have a drug that is safe, not toxic, curative, and cost-effective for the patient, for the family, and health authorities. I would like to ask the pharmaceutical companies to do more research on new antifungal drugs, because the available antifungal drugs are not very effective for the management. I would like to ask the international community to pay more attention to mycetoma patients. International bodies try to raise funds for helping this patient. And we would like to have more research on mycetoma to answer some of the questions about epidemiology, about diagnostic tools, and about the effective treatment for this patient. I would like to call upon all the international, regional, and local bodies, funding organization, WHO, governmental organizations to work together to raise awareness on mycetoma, to raise funding for helping this patient, to make sure that they have less deformities, less disabilities, and back to normal, and to lead a normal life after that. We hope to conduct the first ever double-blind clinical study on a new drug for mycetoma patients. And we hope this drug will be effective and can cure patients. The proposed study will be conducted by DNDi, Drugs for Neglected Diseases Initiative, based in Geneva, the Mycetoma Research Center, University of Khartoum, and the Eisai company in Japan. The objectives of this study are to try new drug, to see how safe the drug is, how effective the drug is, and can easily be administered for the patient. We hope this drug will be safe, will be cost-effective, non-invasive, and can cure this patient. We are optimistic because at the lab level, this drug was found to be effective against the causative organism of mycetoma. We are at the center very much excited to conduct this trial, because that will be the first ever clinical trial on mycetoma globally. We hope that the drug will be effective because laboratory work showed the drug works against the important fungal infection. And we hope this drug will be working in the human being. Hopefully with this clinical trial, a successful one, we'll have a drug which can be used, and the drug can reduce the morbidity and mortality of the mycetoma in Sudan and globally, and that will improve the quality of life of this patient. That will improve the working capacity of this patient. That will reduce disability, deformities due to the surgery and due to toxic effect of the drugs available nowadays. Because the treatment is not very effective, they undergo many surgeries. One of the patients we saw here in the center, he had 40 operations. He stayed in the ward for 3 years. And in spite of all this, he had a recurrence recently. And that means that the treatment was not very effective, and we are looking for safe, effective, cost-effective drug which can help this patient. Some of the patients, they continue having the treatment, but without any benefit. And eventually they will end in amputation. And I can imagine the misery of this patient having the treatment for a long time, and they end with an amputation. Amputation in developing countries is a social stigma, and most of the people try to avoid having an amputation. Sometimes the patient may be in a very bad shape due to secondary bacterial infection. The drugs are very expensive, they cannot afford it, they will ask for amputation. Mycetoma is difficult because we don't know how the infection is taking place. Difficult because we don't know if there is any intermediate host in the infection. Mycetoma is difficult because the available treatment is not effective. The available treatment are expensive, they are not curative, and the patient may have a lot of effect of these drugs, toxics and side effects. The fungus is difficult to treat because there is amylinine. This is a pigment around the organism, and this pigment prevents antifungal drugs to attack the organism. Mycetoma patients are unique patients. They are poor of the poorest patients in remote areas. They are of low socioeconomic status as well as low health education. Because the problem is painless, many of the patients present late with massive disease, with deformities, and with difficulties in executing their normal daily activities. In fact, it is a social stigma, the mycetoma. Many of them cannot share their normal social activities, they cannot get married, and eventually they leave their work because they cannot be able to do that. They start to be dependent on other member of the family. And again, that is another social burden and economical burden on the family. The available treatment for these patients are not very effective. Had many side effects and may be toxic. We hope in the future we're going to have an effective drug which can cure this patient. We hope the drug will be safe, will be economically affordable by the patient, and may be available in the rural and endemic areas. We hope in the future we have a diagnostic tool which is field friendly, which can be used easily and not invasive and not toxic, and be affordable for the patient and the health authorities. About 70% of our patients are less than 30 years of age at presentation. Most of these patients are of low socioeconomic status. They are poor population living in remote areas. The cost of the treatment is very expensive. It may amount up to $5,000 per year, bearing in mind the income of these patients not more than $30 per month.